Since March of 2020, COVID-19 has been affecting our country and many parts of the world. Now, Frederick County has a number of COVID-19 testing sites scattered around the county for accessible testing for residents. But recently, Frederick County's Division of Utilities and Solid Waste Management thought of a better way to test for COVID-19 in the county by testing the wastewater.
We began collecting samples in May of this year for coronavirus analysis.
The Ballinger-McKinney Wastewater Treatment Plant has around 7 to 8 million gallons of wastewater flowing through it a day. Flows come from all portions of the county.
We have service in areas of Adamstown, Urbana, New Market, the Linganore area, and portions ringing the city of Frederick, north of the city, south of the city. The wastewater is composed of what's going down drains in the fixtures within homes and businesses. What we see at Ballinger-McKinney is representative of the waste stream, laundry, showers, kitchen wastes, bathrooms waste.
Staff members collect samples of wastewater twice a week at the wastewater treatment plant, and then it is shipped to a lab in Rockville named Cosmos ID, where the samples are examined and tested for COVID-19. The process is simple.
We've chosen a point in the wastewater treatment plant that's representative of all the flow that's coming into the facility before it's received any treatment whatsoever. Once staff are properly garbed in protective equipment, and they're simply dipping a sample of that flow coming into the plant.
By now you're probably wondering, what are the advantages of testing COVID-19 in wastewater? Frederick County's health officer, Dr. Barbara Bruckmeyer, has the answer.
From a public health perspective is that it, at this point, seems to me to be the single best tool to gather surveillance data for the whole county. And by surveillance, in my mind, what that refers to is to be able to know what is the level of infection or virus activity in our county. So part of what we know from individual humans, though, is that from studies, people can start to have virus shedding and virus showing up in their waste several days before they develop symptoms. And we also know from our local data, which is also similar to the national data, that up to 40% of people who have had tests and have tested positive say, I don't really recall ever having symptoms. So we're looking forward to seeing whether we can see whether there's a correlation between the results, between the concentration of virus in the wastewater and what we're seeing in the community. And if there is a correlation, does that correlation give us some advanced knowledge or maybe some forecasting of what is occurring in our population, but we aren't yet seeing in the testing results and the hospitalizations.
Frederick County has been one of the leaders in the state for testing wastewater for COVID-19, but scientists are still developing better ways to find significant data.
We've been getting some results since May and June of this year. Hopefully, once they get everything worked out, they're able to turn those samples around in 3 to 5 business days.
It's worth at least a trial of 6 months to see what we can do in terms of both advancing the general scientific knowledge for everyone's benefit, and then also specifically to see how that can better inform us about the situation and the experience in Frederick County.